I fear that we will be hearing a lot more about this one way or another. Thank you for that. Now, it was the adjustment heard around the world. Listen to this.
To get it in the right place. That's why we be quick. Hey, darling.
That click. Well, the video shocked many who are calling the practice cruel and unnecessary, but is it? Well, joining us now is Dr Hayden Thomas, chiropractor and spokesman for the New Zealand Chiropractors Association. Hayden, thank you for giving us some time this morning. Have you ever seen this before? This baby, what, just weeks old, have you ever seen it or even done it yourself?
Well, I can certainly understand that, some people have not had experience with chiropractic or see a, short clip like that of, out of context of a whole clinical encounter could be concerned. But certainly, it's a routine thing to adjust babies to help their spinal function, especially if they've had a traumatic birth, which has caused some restriction and injury in their spine. It is common. It is common, is it?
But even, it's the click. Isn't it? That's what gets everyone.
Yeah, that particular technique is not necessarily used all the time. There's many different methods. So it's really down to the clinical judgment and experience of the individual practitioner, the chiropractor, who are very, very highly trained health professionals. And, it's also done with informed consent with the parents. And it's, there's a lot of discussion around, any healthcare intervention.
Interesting what you say, Hayden. So there are more gentle approaches potentially to be used, but you would have no concerns over what you saw in that video?
Well, if it's done precisely controlled and, like you say, you've got to make a choice of what's the appropriate technique to use in the situation. I can't speak to, what's happened to that poor little baby to mean she needs care. It sounded like she had a pretty rough start to life.
Right, so that's an interesting one, isn't it? So, Hayden, give us a context of situations where this is of benefit to such tiny little newborns.
Well, we certainly see a wide range of conditions from, people coming in. Our main concern though is improving spinal function. So we're really helping that nerve system, brain-body communication, and getting that movement back in the body when there's been some trauma, usually to the spine.
You were talked about how, properly trained chiropractors should be able to do this. Is it a pretty hard technique? Is it something which takes a lot of thorough training?
It takes years of skill, and it's also knowing a lot around it, when you're considering when it is appropriate to use a specific technique. So there's a lot more to it than that, than just pushing on the spine. It's very, very precise.
Yeah, I'm sure. You've got the chiropractic board annual general meeting on at the moment. Are you going to be talking about this specifically, or as professionals, is this just accepted that this particular video has got everyone very excited and now let's move on?
Well, I guess the issue we have around it is, the whole concern around social media and posting things on that when it's a clinical setting. And like you see, there's a whole 6.5-minute clip of that. That's a very short piece out of it. So
this is the
I think you've got to get the context.
Loud click in it, which gets everyone aghast.
Yeah,
that's interesting, isn't it? Tell me, GPs, paediatricians, midwives, other professionals within, sort of caring and concerned for newborns, have they ever shown any concern for the practice, or are they pretty much in support of what the chiropractor will do in order to alleviate the discomfort or the pain the baby's in?
I'd say in New Zealand we enjoy, really good support overall. My practice personally, I get regular referrals from local GPs, midwives, for babies that are having challenges, and the whole range of ages from newborn to the elderly. So it's very common routine for healthcare professionals to work together for the patient's benefit. Thank
you very much, Hayden. Dr Hayden Thomas from the New Zealand Chiropractors Association.
Thank you.
Now, it turns out